My name is Marie Furlow, uh, and this is entitled Healthcare Leaders and the Centers for Disease Control, or CDC. The CDC is a federal agency of the United States, and it's focused on protecting public health. Its main focuses include preventing disability, disease, and injury. The initial founding of the CDC occurred in 1946, and it was initially established to control and prevent malaria outbreaks. Over time, the CDC evolved to include focus on preventing infectious disease, environmental health, injury prevention, occupational safety and health, health promotion, foodborne pathogens, educational activities, among others. As healthcare leaders, why do we need to know the CDC and what do we need to know about it? We need to be familiar with the CDC itself and its offerings, because it's a vast resource of information that's present for us. There's information about safety for our workplace, such as information about chemical injuries in case someone does get hurt. Information about statistics for specific disease rates, such as influenza or Lyme disease, can also be found here, as well as specific suggested treatments for diseases and pamphlets that can be given to patients to help them reduce risk of disease. They're all located on the CDC website. Vaccine schedules for children, adults, and any immunocompromised patients are available here, as are listings for country and region-specific travel immunizations and recommendations. A wealth of information can be used and relied on. It's available from the CDC. Following are two examples of how the CDC may be used by healthcare leaders to improve patient care and benefit their workforce and patient populations. The first example is one that I ran into a few years ago head on. As a healthcare leader at a local nursing facility, you diagnosed your first patient of the season with influenza. Then, two doors down, you note the same symptoms in three separate residents, likely flu as well. Influenza is spreading rapidly, and you need a plan before the building becomes quarantined and an epidemic occurs. You search the CDC website for suggestions. The CDC lists their recommendations for the current year to prevent the spread of disease, including placing all residents on prophylactic Tamiflu for a longer period of time than the general population. They also recommend starting with a treatment dose of Tamiflu when influenza is suspected and not needing further swabbing after the first few documented cases in the building. You place all of your patients on the preventative dose, recommend quarantine infected residents to their rooms, and for residents not to leave their units. You also notify the medical director of the CDC recommendation, tell the director of nursing to call the State Department of Health to notify them, all per the posted guidelines from the CDC. Over the next week, the influenza spread somewhat, but many residents were protected with the preventative dose and quarantining in room and unit. Those that did get infected were much less sick, as they did receive antiviral treatment promptly. The second example is related to infectious disease as well. You are a manager in the ICU who needs information about central line infections, as you believe that your nurses are practicing strict hygienic technique when accessing these lines and are trying to figure out ways and troubleshoot to see if something's being missed. There's a 10% rise in these infections over the past 3 months on this unit. The CDC website provides information on healthcare-acquired infections, including central lines and Foley catheters, among many others. After handing out pamphlets to patients and patients' families about what they can do to minimize catheter-related infections, you note drop in these infection rates by 5% in the first month alone. You've also decided to discuss with interventional radiology to see if there's anything that they may recommend to prevent infection when inserting the lines and after when the patient is in the hospital. The CDC does offer resources to healthcare leaders and can help us find information of disease prevention, workforce healthcare related questions, healthcare acquired infections, current disease management, as well as a wealth of other topics.